Welcome back to our TCVM Focus Week. So we've discussed TCVM in general, how we can use it and how it differs from Western medicine. And then yesterday we talked about acupuncture, sort of how it works as far as we understand it. And today I want to talk about Chinese herbal medicine. In traditional Chinese medicine, herbs have been used for thousands of years. And really interesting, when I went to China to study, one of the human Chinese medicine hospitals that we went to actually had a huge herb garden out behind the hospital where they actually would go out and get the herbs and make their own herbal formulas from it. So the formulas can be made as powders, dried powders. They can be made as tinctures. They can be made as tea pills, which are really concentrated, compressed herbal, dried herbs compressed into a tea pill. For those of you who are using tea pills, we do have tea pills on our website. Make sure that you crush them with a pill crusher or put them in a baggie or a plastic bag and use a hammer on them. Don't try it without the bag, having them contained, because they will fly all over the room. But we do need to break them open. If you don't break them open because they're so compressed, a lot of times the stomach acid is not enough to break them down, particularly if your animal is on some sort of an antacid. And so then you end up finding tea pills in the poop, and they don't do much good if they go straight through without being absorbed. So I do use a lot of tea pills. I also use powders and capsules for my guys. So we can do a lot of different things with the Chinese herbs. Over the thousands of years, Chinese herbalists would go up into the mountains and procure the different herbs, basically out in the wilderness, finding what they needed, and then trying different concoctions, basically, of the different herbs and looking at how they affected the body. Do they make you sweat? Do they warm you up? Do they cool you? Do they cause vomiting? Do they cause increased urination or diuresis? Do they help clear the lungs? And so over many, many thousands of years of observation, we have great descriptive properties for herbs based on their taste. Are they pungent? Are they bitter? Are they sweet? Are they sour? Are they salty? And then their mechanisms of action. So when we look at the animal and we do our diagnostics, which remember is going to include touch. So we're going to palpate, we're going to feel acupuncture points. We're going to smell. Is there a smell coming from the mouth? Is there a smell coming from the ears? Is there a smell in the eye discharge? Is there a smell coming from the skin or the coat? We look at tongue color, tongue color, coatings, shape, size. Do we have a thin, dark red, dry tongue, or do we have a swollen, wet, pale tongue with a white phlegmy coating? So there's so many different ways we can describe that. We also feel the pulses, and with those pulses, we're feeling to see, are they choppy? Are they fast? Are they slow? Do they have an abnormal rhythm? Do they feel full? Do they feel thin? All of those diagnostics we use to put together our pattern diagnosis. So is the individual too hot or too cold? How are they out of balance? Do they have pain in a certain area of the body or in a certain meridian or in certain acupuncture points? Do they have a lameness? Do they have discharges? So we look at all of those things and we say, okay, well, I see that qi or energy is not flowing through a particular area. For instance, I talk about liver qi stagnation a lot. Or I see that we've got a mucus or phlegm buildup in a certain area. So then we're going to look through our herbal formulas and say, okay, well, I need to solve this issue. And how am I going to do that? So we might use herbs that harmonize and bring things into balance, helping things to play well together. One of the great harmonizers is licorice. So we see that in a lot of Chinese formulas because it is kind of to smooth everything out. But then we also have herbs that are going to help warm. They're going to help warm those old cold animals, or even those young cold animals that have Jing deficiencies or they didn't get enough life essence. So we can use herbs to help warm the body. One of the greatest cases that we had go through our clinic was an old dog who was down in the hind end, also had some urinary incontinence, and the owners brought the dog in for acupuncture. And one of our younger veterinarians who was just starting out learning TCVM also prescribed an herb called hind end weakness. Unfortunately, hind end weakness is for a dog who is too hot but is weak in the back end. This dog was too cold and weak in the back end. So when the herb was prescribed, the animal actually got worse. So once we determined that, oops, that was not the right herb for this dog, this one really needed a warming, tonifying or tonic, a warming tonic and a chi tonic, an energy tonic for the back end. We used that in conjunction with the acupuncture, and within a couple of weeks, the dog was using the back end really well and not having urinary accidents anymore. So the herbs can be really, really powerful. And if we pick the wrong herb, we actually can kind of send things off in the wrong direction because we are strengthening the imbalance rather than bringing the imbalance back into balance. So we can use things to tonify. So that is to increase the strength of something. So increase the chi. We can also build blood with our herbs. We can move phlegm. We can drain damp. So when we look at herbs, it's really just a concentrated formula. And so we could use, like I could go out in my garden and pick basil. I can pick any of the herbs that are out there and add them to the food. But when we take those herbs and we dehydrate them, dry them, basically strengthen them and make them more concentrated, then we get a much stronger effect with much less of the amount of material that the animal has to eat. So that's why herbs come in different formulas. We can also use herbs in other ways. So we can make them into a topical application. We can also, with a salve, or we could do a topical application with a tincture. So a lot of times, particularly in horses, we'll make bandage wraps that have the herbal formula on the animal, on the skin, and then we put the wrap around that to get the effect that we need. So whether we're trying to warm the area, bring circulation to that area, whether we're using herbs for healing wounds, or herbs for taking some inflammation out, resolving blood stasis, we can use those as wraps as well. We can actually use herbs as liquid extracts applied to the ears or to the eyes. There's also a technique called blowing nose, where we blow the herbs up into the nasal cavity of the animal, commonly used for colic or seizures, because it can temporarily relieve the clinical signs. So there's one called Shui Bi San, blowing nose powder. It's a powder that relieves colic pain when blown into the nasal cavity of horses, which is pretty cool. And we can hot pack. So for instance, if you have, say, an area of trauma with a bruise or swelling, we can hot pack with the herbs under the hot pack to try to help dispel that stasis, that blood stasis, and make things feel better. And then we can also use herbs for cleaning. So from a Western standpoint, I talk very commonly about using witch hazel, which is an herb, for cleaning ears. Because it has antibacterial properties. It's soothing, it's cooling, it doesn't sting, it doesn't leave moisture in the ear. But we can also use those herbal formulas to treat prolapses or mange, spasms, anything like that. There are literally thousands and thousands and thousands of Chinese herbal formulas. And again, it's like learning a foreign language because the herbs are given Chinese names. They also have more westernized names. And sometimes they'll be listed as 2 or 3 different names, and it's all the same herb. And things that are used in herbal formula also include some minerals. So it may not be just an herb. Mushrooms are considered herbs, but things that they've really gotten away from, but that have been used in the past: rhinoceros horn, donkey skin, a lot of things, snake bile, a lot of things that we move away from just for environmental and ecological reasons and not doing harm to animals. But some of the things that have been used over the thousands of years were things that were tried to see how they would have an effect on the body. And that's how we get our herbal formularies. And so then we have each individual herb or ingredient that has been tested. And then we look at what happens when we combine that with something else to maybe intensify what property we're looking for, or to help soften that property or balance that property. So sometimes you'll see herbal formulas that have 1 to 4 ingredients. Sometimes you'll see herbal formulas with 8 to 12 ingredients. And that's why there are literally thousands and thousands and thousands. A good herbalist who has had a lot of training will be able to fine tune a formula for the individual problem that they are seeing, where the imbalance is in a particular pet. So I am not one of those herbalists who can fine tune everything. I have my basic principles, and that's what I use. And if I need to dive deeper than that, then I'm going to go find one of those herbalists because they are amazing. Hope that helps. Have fun with it.